And then the same token, what was happening during the plagues, here's like the factor. What is the vector of the disease? So with like flu, COVID, humans are the vector. Humans are spreading it to each other. But if you have a drug, if you have a pathogen that spreads not by a human, then the death rate is irrelevant because the vectors aren't being knocked off by the death. The entire thing is that the vector needs to stay alive. And during the plagues, the vector was rats. It really wasn't human to human transmission. It was mostly rat to human transmission, which also speaks to the public health interventions of cleanliness, sewage. So, yeah, I guess what public health is doing right now is probably like if there are like efforts to try to cull vermin in the city, that's probably very helpful. Um, if they're keeping sewage clean, that can be very helpful. I know that there's public health efforts in Cleveland to remove lead from the pipes and water. And they're even going into individual houses that have lead pipes and they're trying to cover the pipes or replace them. So there are some issues where public health can be very useful, but that tends to be at maximum like the city level, a municipality level. And once you get to an entire nation and then you have a public health apparatus that's trying to regulate everyone at once, well, they just don't have enough information to make that effective.